Well, I'm very glad to be here with Cheryl and Dusty today from Conduit Health Partners, eager to learn more about what you do, the problems you're addressing in the healthcare industry, how you're working with hospital systems, what results you're seeing, and so on. But let's start with some introductions. Tell us a little bit about yourself and your roles.
All right. Well, hi, I'm Cheryl Dalton Norman, president of Conduit Health Partners. I am one of the founders of Conduit, and we started in 2017, really just thinking we were going to be serving our parent organization health system. But from there, what we found was other contacts, other people that we knew were reaching out to us for assistance. And really that was the origin of Conduit, was other people coming to us saying, hey, can you help us because access is important to us. I'm a nurse by background. I've been a nurse for 42 years. So, been around the block a little bit and excited to be able to partner with health systems and other folks who are concerned about access for those they care for.
Fantastic. And Dusty?
Hi, I'm Dusty Browning, Vice President of Growth and Client Solutions for Conduit Health Partners, also a nurse by background. I've been a nurse for 30 years and joined Conduit in 2017 to start the nurse triage program.
Yeah, well, that's great. I come from a family of nurses, so I love meeting nurses. But tell me about, it seems like a lot of your leadership team has a lot of nurses. Tell us about that story and is that intentional?
Oh, it is very intentional. And one of the things that we believe is that we need to have knowledge and experience in the industry in which we're serving. So that's really important to us. If we're solving problems around access, if we're solving problems around nursing, having adequate staffing, those kinds of things, if we're helping our partners, we really believe in having the skills and the knowledge to speak from experience. So while we do employ people who aren't nurses, you were obviously raised well if you were raised by nurses, and we enjoy having nursing leadership within our company, and we value our staff members who are on the phone, where we really focus on a nurse first model, to where we're able to help people really quickly.
Oh, that's wonderful. Now, you've mentioned some of the core problems around access and others. So let's dig into that a little bit, because access is one of those age-old issues that every health system I know is working with. So break down, what specifically are you working with, and why is it important to solve it right now?
Yeah.
Certainly.
Dusty, you go ahead.
I was going to say we have two core services at Conduit. We have our patient transfer center service as well as our nurse triage solution, both of which are designed to really address access issues. Since we began service in 2017, we have managed over 11 million calls from patients or providers. And we've supported more than 400 healthcare facilities with these solutions, trying to solve access issues. So Transfer Center in particular, we offer a comprehensive solution that manages the patient transfer process from start to finish. So identifying a location that can meet the patient's needs, as well as the provider preferences, obtaining patient acceptance, and coordinating transportation. This takes a significant amount of time and really administrative responsibilities in the background. So we're taking the lift off of those that are at the facilities as we facilitate our transfer center process, all the while ensuring that patients are receiving care, able to receive care at locations that can appropriately care for them. So again, just facilitating that access for the patients that are acutely ill. And then from a nurse triage standpoint, we work with healthcare systems in a variety of different ways. Again, just enabling access, whether we are the clinical support from a call center aspect or supporting their employed medical groups to really reduce on-call burden and ensure that patients receive care or clinical care timely. In addition, we're able to align our nurse triage solution to reduce unnecessary ED utilization and really guide callers to appropriate levels of care within the system.
You know, and I'll add a little bit, and Dusty described it really beautifully. Access means a lot of different things to a lot of different organizations, and we really work hard to make it real and visible to the patient, the people that are being served, whether that's in the transfer center, you're in an ER that doesn't have the capabilities where you that you really need for your level of care. So we quickly get you to that other hospital. Or if it's the middle of the night and you have a sick kid and you're going, please, someone help me know what to do, just to be that real access point. Because I think it's easy to say, because as you mentioned, it's a buzzword, access.
Yeah.
But what are you really doing about it?
Exactly.
And what we do through our partnerships with health systems and medical groups and employers and FQHCs, we are really helping to have measurable impact that really drives access to care, and it reduces the administrative burden for the people who are trying to give care.
Yeah, and thanks for breaking that down, because you're right. I think we've been all trying to solve access, and you have very specific ways you're doing that. So the transfer center and then the triage line, and you're providing the services, you said, to actually staff those, do address that, right? Okay.
Yeah,
And then you had started to mention results and impact, because that's an important piece of this. Tell us a little bit more about what you're seeing and how you're measuring.
Yeah. Dusty, do you want to talk about the impact we've had?
Yeah, certainly. So a couple projects come to mind. First being transfer center driven. So working with our partners to really understand their strategy and their pain points to help create solutions that are going to be effective within their organization and really drive the care that they want to deliver. So two things really come to mind. One, we had a client that was really looking to decrease their time that patients were spending in the emergency departments. And they had an organization that was set up to where they had a metro facility that had a lot of capability, and several community facilities within their network that also had high capabilities, but not so much as the facility within the metro area. And we work with this organization to really understand what can these outlying facilities support. And by understanding that and ensuring that we had processes to implement very quickly when the organizations were calling for service, we could redirect away from the metro area that was often very crowded with longer wait times, and still directing the patients to areas that they could receive appropriate levels of care. And by doing so, we were able to decrease the overall patient transfer time by 34% and increase admissions into those outlying facilities by 54%.
And reduce the ED length of stay. And this is huge. If you've ever been
Yes.
in the ED and you've waited hours and hours
Hours.
and hours, we were able to have a 64% reduction in the emergency room length of stay for these patients who might have lingered for, a long period of time.
Yeah, and Cheryl, the workflow that you're speaking of is relevant to behavioral health. And that is, we all know that there's a significant need for behavioral health access. And we continue to work alongside of our partners to solve for the issues that they are faced with. It's not uncommon for patients with behavioral health needs to wait in the EDs for long periods of time, waiting for placement in other facilities. And through our process improvements, we were able to partner to, like Cheryl said, see that 64% reduction in ED stay for those behavioral health patients.
Yeah. Absolutely.
Um,
And we also measure in the triage space, we measure the reduction in ED
Mhm.
referral. And now,
yeah.
let me be very clear. If you need to go to the ED, we're getting you to the ED.
Mhm.
However, if you don't need that, and if there's a better location for you to go to, somewhere that's quicker, easier, better care,
Mhm.
more appropriate care, we measure that so that we know where are we sending
Mhm.
people and why are we sending them there. So we can partner with the organization to show improvement, help them plan for operational improvements, and really take better care of their patients.
Yeah, and with regards to ED avoidance, on average, we see about an 84% ED avoidance rate. Now, this varies by client, but that is our average.
Well, that's great because I think everything you're talking about is towards this vision that I hear more and more health systems say, how do we get
Mhm.
this vision of right care, right time, right place with the right resources?
Mhm.
Yep.
Really hard because most people go to the ED because they don't know how to navigate and they don't have the resources to tell them about the other options. And so you're not just affecting the patient's access, but also the critical metrics for a health system around throughput and others. So I can see how you're addressing multiple aspects from an access standpoint.
Yeah.
Absolutely. And whenever we can direct patients in particular to primary care or align them with a primary care provider, we know that that care coordination and continuity of care is going to be so much better than if they had went to just the emergency department.
For sure. For sure.
Absolutely.
Now, some of these organizations may be trying to do these services internally.
Mhm.
That's why somebody would outsource them.
I'll take that, Dusty. Let me,
Okay.
let me be clear. Anyone can do the things that we do.
Okay.
Mhm.
However, is that the best utilization of their
Mhm.
resources?
Mhm.
And do they have the focus, time, and expertise?
Right. Yeah.
So we really, again, can you? Sure. Should you? Maybe not. So we really focus on helping organizations optimize the care at the bedside, give them
Mhm.
all the data they need to make really good decisions to better take care of people. And we spend our time really being expert in our service areas so that they can have the confidence that they're delivering great bedside care. We're taking care of those things that can be lifted away, and we're accountable to them for results, and we're partnering with them for results. And that's our focus. Dusty, other thoughts that you may have?
Yeah, and from an outsourced model in particular, you hear about staffing shortages, in particular nursing shortages, all the time. So enabling communities to really use those nursing resources that they have in their communities to take care of patients
Yeah.
is pivotal. So an outsourced service. Our team is remote, and some of our associates are located throughout the United States. We're not pulling from the communities that are providing care directly to the patients. So it really enables them to optimize their resources. And then just understanding the value of transfer center in particular. On average, there's a 3-to-1 ROI for an outsourced transfer center.
That's a significant number. And you're right
Yes.
about with the overall supply demand problem
Mhm.
across the country. We have to think about
Absolutely.
new models of pooling resources that can
Mhm.
be available to multiple health systems versus pulling from the community where there are shortages. So I think
Mhm.
the model makes a lot of sense. Now, there may be others who offer something similar. How do you see yourself different from those?
I would
Certainly.
go
Go
ahead,
ahead,
Dusty.
Cheryl.
We both want to tell you. But I think one differentiator is that we really focus on a nurse-led and a nurse first model in most areas where we're serving. We believe that getting to someone who can help you immediately, particularly in that triage space, so that you're not giving all your information to someone who can't help you in the moment and then waiting for someone to call you back. When I need help now. And we feel like our clients and those that they serve really enjoy that and believe that that's important too. Dusty?
Yeah, just adding on to what Cheryl mentioned, getting that help now from a nurse. Our competitors typically have a callback model to where patients are calling in, they're speaking to an unlicensed person first who's capturing some information and perhaps putting the call in a queue for the nurse to call back or leaving a message for the nurse to call back. What we found and what our clients have said, that timing, just having that quick access to a registered nurse is really the differentiator in a patient deteriorating and needing to go to the emergency department or making the decision to go to the emergency department unnecessarily while they're waiting for a call back.
You know, Dusty, and that brings, I'll never forget this situation that one of our partner organizations, a large health system, shared with us. They had one of their callers who called our nurse. Our nurse heard the patient it was a nurse who immediately heard the patient, heard how they were speaking, stopped the triage, called 911, got them moving because they could recognize they had the clinical knowledge and expertise to go, we don't need to go any further. I know where you need to be. And recognizing those kinds of issues, I think it's really important.
Like life critical decisions that are made really quickly. That's a great story. Any other, I know you shared some previous stories too. Anything else you'd like to share from success stories or data that illustrate the impact that you've had?
Yeah. We just had one today, Dusty. I know that it came across for us. We had just worked with one of our partner organizations around cardiac events, STEMI. So, and ST elevated myocardial infarction, heart attack, essentially, for those who may not be familiar. And this was a rural hospital that had been working with our partner organization for a while. And we worked with our partner organization to really put in some very streamlined processes that would get those patients who are experiencing a cardiac event out in the communities, the rural communities that they serve, get them moved rapidly in and into the cath lab quickly. And actually this hospital reached out to our partner and said, hey, this is amazing. You know, we were able to move this patient so quickly. And I think about those nurses, and Dusty, I know what you'll appreciate this, and you've been in these shoes. If you're in a facility that doesn't have the capability and capacity to take care of someone, as a nurse, it is a horrifying experience because you are standing there with this patient and you are trying to get them somewhere where the level of care that they need is. And so when you have a partner like Conduit who is able to quickly make that happen, get that physician acceptance, get that ambulance moving, get that helicopter flying, get that patient there. That's huge for the nurse at the sending facility as well as the receiving facility.
That's a great story. It's a great example of how effective and quick your services can make these situations move for the nurses, the hospital, and of course the patient's family as well.
Absolutely. And just adding on to what Cheryl said, for those that are at the bedside, at the facilities, if they have to coordinate these services on their own, it's really taking their focus away from other patients too. So
right, that's such a good point. This has been a great conversation. As we wrap up our time here, tell us where are you heading? You already have two great services. Where's Conduit going in the next few years? Anything else you'd like to share with the audience of upcoming resources, conferences, things like that?
Dusty?
Certainly. Let's talk about conferences first. I know Cheryl's going to be attending the AVIA Summit later this year. We will have some of our leaders at Rise West and Rise National. So we would love to meet with whomever and talk about our services or just collaborate about how we can improve access together. From the standpoint of what next, we're always looking for opportunities to just improve our efficiency because improving our efficiency enables us to touch more lives.
Yeah.
And, because we are a nurse-led and, out of our 210 associates within Conduit, over 150 of those are registered nurses. One of the things that we have the ability to do is to be creative with partners around, what is next as AI is coming forward. We have the flexibility and the talent within our nursing teams to do really creative things that I think sometimes can be a little overwhelming if you're trying to take care of patients, and you're trying to make sure that things are happening at the bedside. We have that ability to partner and think creatively and differently, and we really are excited about the future.
Well, that's a great note to wrap us on. Thank you for sharing what all of you've been doing, the impact that you've had, and where your vision is taking you next. Cheryl and Dusty, thank you for your time. And for those listening, learn more about Conduit through AVIA Marketplace, but also reach out to Dusty and Cheryl as they have indicated, and at the upcoming conferences as well. Thank you both.
Thank you, Sonia.